infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, last week, the CDC reported a record-breaking estimated 900,000 flu hospitalizations and more than 80,000 deaths in the U.S. last year during the flu season. Now, my guest today makes the case in an article in the magazine Self that while the flu shot is not 100% effective, you really still need it. So joining me now is the author of the piece, Tara Smith, Ph.D. Dr. Smith is an infectious disease epidemiologist and a professor at the Kent State University College of Public Health. Dr. Smith, welcome back to the show, ma'am.
Thank you for having me back on.
You bet. Now, the effectiveness of the annual seasonal flu shot has shortcomings each year, with the effectiveness being lower than most people may realize. Dr. Smith, why do we see such low numbers in some of these years?
Right. So influenza is a moving target. So unlike measles and mumps, which don't really evolve very much year to year, influenza is an RNA virus, and it changes a whole lot from year to year. So every year we have to recreate a new virus for it, or new vaccine for it, excuse me. So we have centers across the globe that track influenza throughout the year, and we use what they find as far as the most common circulating viruses to develop our vaccine for every year. So looking at those in about February, we try to make the vaccine to come out in the following fall for the Northern Hemisphere. So the reason it's not always perfectly effective is that sometimes we get a poor match. We had that a couple of years ago that what was predicted in February just didn't match what was circulating in the fall. So that's one reason. Another is that sometimes the viruses can mutate a little bit between fall or between spring and fall, so that even though they're close, they're not quite an exact match. Another is just that, again, there are a number of circulating flu viruses out there. So even though the most common ones will be captured in the vaccine, some of them will not. So people can still be infected by other influenza viruses that are not represented in that vaccine every year.
Yeah, now while the effectiveness numbers are pretty low some years, you argue that the public should still get the annual flu shot for a whole host of reasons. Can you talk about them?
Yeah, so when we talk about vaccine effectiveness, that's only how effective it is at completely preventing illness and infection. So that's one aspect of influenza is that, of course, you don't want to get sick, right? But another thing that the vaccine does that is not really captured in that effectiveness percentage is that even if you do get sick with influenza and you've been vaccinated, it actually keeps you from getting really sick. It prevents people from needing to go to the doctor, prevents people from needing to be hospitalized, and it prevents the most serious infections with influenza, or reduces your risk of them, including death. Of the children who were confirmed to have died from influenza in this past season, about 80% of them were unvaccinated. So even though we think about it as just preventing illness, it really prevents a whole host of other things that can be associated with illness.
Now, it is about that time of the year for people to get their flu shot in October. And Dr. Smith, can you talk about what flu shots are available for this 2018-2019 flu season?
Right. So there's a couple of different versions out there. So there is either a trivalent or a quadrivalent shot. So the trivalent shot would have two strains of influenza A. Influenza A is the one we typically think of as the most nasty strain. So it'll have two different types of those in that, and then one type of influenza B. So influenza B usually is more mild, but sometimes can also cause very serious infections. So we try to prevent against both influenza A and influenza B in the shot. In the quadrivalent shot, it will have two strains of influenza B then, so an additional one of those. We also do have the flu mist available, so that hasn't been on the market in the last few years in the United States because it was ineffective a couple years ago in some analyses they did after the flu season. But they've tweaked that a little bit, and they think that it will hopefully work well again this year. So even for people who are fearful of needles or don't like getting shots, that will be back out on the market as well. And then there are also high-dose influenza shots for people above the age of 65. So they have more of the flu antigen in them. So seniors where the influenza shot usually doesn't work quite as well can get those, and those work better than the typical influenza vaccines for people who are older.
Okay, last thing is, any final thoughts on this upcoming flu season, the vaccines, or vaccines in general?
Right. So last year's flu season, of course, was pretty terrible.
Right.
Hopefully we will not be looking at one that's quite as miserable this year, but it's always hard to predict. Flu, again, is so unpredictable. But besides the vaccine, of course, you want to do everything you can to keep yourself healthy as well. So even if you've been vaccinated, you still obviously want to wash your hands, to keep your distance from other people if you are feeling ill, to, not go into work. Or into public places, if at all possible, if you are potentially infected with influenza, to prevent spread to others. And if you are able, to get the vaccine, do that to protect not only yourself, but to protect others around you who may be vulnerable to influenza.
Okay, well, I really enjoyed the article, and I'll put a link to it up on the website. And I want to thank you, Dr. Tara Smith, for your time and your expertise, and thanks for the article.
Thank you so much.
You bet.